The University of Ghana Medical Center, in recent years, they've been around and there's been a lot of talk about them. Some people have come on my show and spoken about the great things they are doing, state-of-the-art equipment and everything. But today they are here soliciting your support and mine for their InPatient Clinical Trials Unit, which is why this morning we're hosting Dr. Christian Owu, who is Chair Subcommittee on Fundraising at the UGMC Clinical Trials Unit, and Ebenezer Kwapong Owusu, Senior Manager, Business Development, IT Consortium. Doc, Ebenezer, a very good morning to you. I'm going to have to do a bit of a switcheroo, so who's who?
Good morning, and good morning to your audience.
Right. Okay, so let's start with what exactly brought up this need for an inpatient clinical trials unit in Ghana at the UGMC, to be precise. I'll start with you.
Start with Doc.
I should start with Doc first. Okay, so Doc.
All right, so thank you very much. So we all are aware that in the health sector, there are a lot of interventions, and all these are basically towards a positive outcome for our patients when we fall sick. But we also told that health is not only about curative, but it's also about promotive, preventive, and rehabilitative. And for many decades now, majority of the interventions we use in our health system, especially in sub-Saharan Africa, including our country, are borrowed from other places, and then with a presumption that they will work as well as they worked where it was tested in our population. But we know that that is not wholly the truth. So we have had situations where medications, devices, interventions that have worked in all the populations where it was tested during development do not have similar efficacy in our population.
Yeah.
So it is important to actually customize and testing them in our own population, in people who we expect that this will be used. And in the last number of decades, a number of African institutions and in Ghana has been progressing towards this realization. You heard a lot about vaccines during the COVID-19.
Indeed, I was just about to mention that.
And then about establishment of the Vaccine Institute. But we would need to get to that point where this is not just research centers, but hospitals that have clinical trial units, purpose-built, that are able to have the capacity. And that is basically the reason that we moved in this direction. A lot of us are into clinical trials.
Okay, so I get the point now. At least you've given us the basics of this. But the next question then is to find out whether all these clinical trials are only tied to research into new drugs or testing of new drugs. What's the clarity on that?
So that's actually why I started off by talking about the different tenets of health, talking about preventive, promotive, curative, and rehabilitative. So it's not only about, medications are the commonest you will hear, but no, it's not about medications alone. So we actually define clinical trials as basically assigning humans or human groups into groups for basically prospective interventions that looks at the efficacy of those interventions and how it affects health-related outcomes.
Right.
Those interventions can be medications,
okay.
They can be medical devices, they can actually be behavioral changes, they can be preventive, like in quitting smoking,
right.
or with respect to vaccine, as we mentioned earlier on. So it's not, and it can be cells or biological entities. So it's not only about drugs. It can also be about change in the process of care that we already given to people. So it may be something that is already happening in our hospitals or in our health institutions, but then we want to see that a different process, does that work better, does it have a better outcome.
We want to take a critical look at the approach and ensure that we are doing the right things.
Yes, exactly.
Let me come to Ebenezer, IT Consortium partnering the UGMC on this. Why are you even doing this? What's behind it? It's a good thing, yes, but what's the motive?
Yeah, so the motive, number one, is the responsibility. We have a responsibility as a corporate organization to help, and so this is part of our corporate social responsibility. When you look at what we bring to the table is the ability to do the collections of the funds. This time through Chango. Chango is a crowd funding app and a group contribution app. We see that for most of the time, even when people want to give, they may hesitate because of they are not too sure of how they are given, the structure they are given through and all that. So
and I see that all the time on social media.
Yes,
some people want to give, but they are uncertain.
Yes,
is it
yes,
true? Is it not?
Yes. We are able and have been able to put a structured way that people can contribute to, and this is open to people even in the diaspora if they want to contribute to this. And to show that, one, we have the ability to do that here in Ghana for ourselves, so that people can easily contribute to a cause like this. And when we heard that UGMC was embarking on this, it pushed us a lot to also go to their aid to help.
And this is not the first time you're doing this?
This is not the first time we are doing this. We've had a number of collaborations. We've had one with the cardiothoracic unit at Kolebu, which is still running, where we have a public campaign, we call it, where public can contribute. And the idea is to get a number of Ghanaians to contribute as small as they can to help with open heart surgeries for kids.
Okay.
Yes, we've carried out a few. We've partnered with Pharmaline.
Okay.
Pharmaline mobilized tools and things to help, fertilizer and things to help farmers in parts of northern Ghana. And we've also helped with individuals who may be going through surgeries and things. We partner with various health centers to get this done.
All right. We have to be out of here before 2 minutes are over. Sure. Tell us about Friday's concert and some of those who are going to be performing. What can we expect, even as we come and donate towards a worthy cause?
All right, so thank you. It's going to be a super concert, very good music, and it is free to the public. We have invited...
Free? It's free,
yes,
y'all.
It
it's
is,
free.
Yeah.
Okay.
We've invited a lot of organization institutions, but we've thrown an open invitation to the public. Among those who will be featuring in this is Neokind, Koda, Jometo, and the UGMC choir. We have a very dynamic choir, right. And they would give good music, and then just to support this very laudable cause that we go into.
All right. Final words, donations, how can people do it? 20 seconds, let's go.
So you can donate on every network on your phone. You go to *887 *222# on all networks, and you can simply donate. You can also go to the University of Ghana Medical Center, that is ugmedicalcenter.org, and go to donate, and you can do that. And to read about Chango, you can go to changoapp.com and read all about Chango. Download it. You can create private groups, you can create public groups, and contribute to various causes, including this particular one.
Okay. And that's how we sew up the conversation this morning on the AM show. Those who joined us for this conversation, Dr. Christian O, chairs subcommittee on fundraising at the UGMC Clinical Trials Unit. We also have Ebenezer Kwapong Owusu, Senior Manager, Business Development, IT Consortium. Right before we hand over to the Joy News Desk crew, Kweku Chere is choir. Today, or I believe it was yesterday, was your you tied the knot this weekend. I beg your pardon. You tied the knot this weekend. May God bless your union and fill it with all your heart's desires. And it's from Aisha Ibrahim of Joy News. And you'll be seeing her on Joy News desk shortly. Kwekuchere, congratulations on tying the knot. And God bless your union. Gentlemen, thank you so much for coming. And we'll be supporting along to ensure that everything goes well.